Hi, I'm Jennifer Akers. I'm the project director for Family Voices Indiana, the family to family health information for the state. And in partnership with Down Syndrome Indiana, we're presenting what to consider when moving to Indiana. Family Voices Indiana is the family to family health information center for the state. This presentation focuses on moving to Indiana, but if you're considering a move to another state, you can check for the Family to Family Health Information Center there. They should have similar info and we'll be happy to help. We're uniquely able to help families because we're staffed by family members who have firsthand experience and training in navigating complex healthcare services and programs. We understand the issues that families face and give you the tools to help you make informed decisions. We can help you better understand your insurance coverage and the appeals process. Our children are often underinsured, so we can make sure you have as many layers of coverage as possible. We received so many inquiries that we created our own waiver journey about the Medicaid waivers as a guide to help you navigate the process. We can send you the applications, help you fill them out, and help you understand services once you get the Medicaid waiver. We also help families access community programs like recreation and support groups. We can provide tools to help you better organize all of your child's records and help you feel more confident when working with professionals. We get a lot of calls from panicked parents of children about to leave high school, so we can help you figure out what you need to consider as your child reaches adulthood and how to plan ahead for this milestone. And underlying all of that is a desire to help you become a better advocate for your own child. You know them best. We get a lot of calls from families who are getting ready to move to Indiana for various reasons, and they frequently say, I need to transfer my services to Indiana. And it's not as simple as that, unfortunately. So I'm going to go over some of the federal and state programs and things that you want to look at as you consider a move to Indiana. Families of children and youth with special health care needs have much to consider when they're thinking about an interstate move. Often the supports and services that they rely on differ from state to state, and a lot of families don't realize that. We're one country, so you would think that it would be the same in every state, but it is not. So we're going to go over some of the things and their equivalents here in Indiana and things that you want to consider. So if your family member receives federal benefits such as SSDI, or Medicare, these benefits will remain consistent regardless of your state. However, some states provide a supplemental payment to some SSI recipients while others do not. Indiana does provide this supplement. So while eligibility for disability and income is often similar, sometimes the amount of your check is going to differ from state to state. So you want to look at that supplemental payment under SSI. Medicaid eligibility and services vary more greatly from state to state. In Indiana, for those with disabilities, Medicaid eligibility is linked to SSI eligibility for all individuals over 18 and some children under 18. And you should consider with all of these programs that you make sure that you change your address, notify the program once you move to the new state, so they can coordinate that transfer. So let's talk about Medicaid a little bit more. There are many types of Medicaid. Most children with special health care needs or disabilities should have Medicaid disability. And in Indiana, this means an individual over age 18 will need to be eligible for SSI in order to get Medicaid coverage. Most of these individuals will be in Hoosier Care Connect, which is managed care, and those families will choose a managed care plan and have to follow the rules of that plan and the networks for those plans. Some children under 18 might access Medicaid disability in other ways. If a child has been hospitalized for more than 30 consecutive days, and if the child has a medically determinable physical or mental impairment, this may qualify the child for Medicaid disability. Parental income and resources aren't considered for the purposes of institutional deeming. If your child's hospitalized for a long time in Indiana and you're a resident here, you want to talk to a social worker or someone else in the hospital who's knowledgeable about institutional deeming. Home and community-based services, or Medicaid waivers, will also waive family income and assets when determining Medicaid eligibility. At this time, children under 18 who have Medicaid via the waiver don't have to be eligible for SSI. Instead, the state will make the disability determination via the medical review team. At 18, the individual will need to be eligible for SSI in order to get Medicaid disability, even under the waiver program. So let's talk about waivers a little bit more. These vary from state to state. So you may have a waiver in your current state and you're looking for what we have in Indiana, and these vary. So I'm going to talk about what we have here and how ours operate. A waiver sets aside or waives some of the requirements for Medicaid. The waiver in Indiana means you can set aside family income and assets for children under 18. However, the individual's income and assets are considered for eligibility at all ages. For individuals with a developmental disability diagnosed before age 22 who meet institutional level of care, Indiana has the Family Supports Waiver and the Community Integration and Habilitation Waiver. The latter is more restrictive, and individuals have to meet certain specific criteria. You apply for these waivers through the Bureau of Developmental Disabilities. There is currently a waiting list for the Family Supports Waiver. At this time, it's less than a year wait. Individuals who meet a nursing home level of care, which could include children with Down syndrome that have significant medical needs, that need skilled care in absence of the primary caregiver, like a trach or a G-tube, there's the aged and disabled waiver. For individuals with a traumatic brain injury, there's a waiver specific to that condition. You inquire about these waivers by contacting your area agency on aging and asking for an assessment. There's currently no waiting list for the aged and disabled waiver. We can help you decide which one makes the most sense for your child, especially if they're eligible for both. So feel free to contact us and we can talk you through it. We've all had children on both kinds of waivers. My own child started on aged and disabled and then moved over to community integration and habilitation. So that's another part of the process we can help you with. We also have a program in Indiana called Children's Special Healthcare Services. You may have an equivalent in the state you're moving from. It is supplemental medical coverage from birth to age 21 for treatment related to a child's serious chronic medical condition. Eligibility is based on diagnoses and household income, and Down syndrome is a qualifying diagnosis. A family with an income at or below 250% of the poverty level, which is around $60,000 for a family of 4, may qualify. It is the payer of last resort, so it does require an individual apply for Medicaid as well, even if they're not going to be eligible due to income. Since some children with Down syndrome also have a diagnosis of autism, you'll want to look at our state's Autism Mandate. Indiana has a law mandating that any accident or health insurance policy that's issued on a group basis, including insurance coverage for individuals with autism spectrum disorder, and additionally, insurers selling individual policies must offer the option to include coverage for autism spectrum disorders. Self-insured plans, where an employer or employee group sets aside funds and employee premiums each month to pay health coverage claims submitted to the plan, are exempt. Another exception to the law involves an employer that's not based in Indiana, but has employees in Indiana. For example, if you work at a company's Indianapolis office, but that company is headquartered in Nebraska, then your health insurance is covered by Nebraska's laws and not Indiana's mandate. So you'll want to look at those different caveats for the Autism Mandate and whether it applies to your particular insurance. Every state has some version of early intervention. They may call it different names, but it's under federal special education law. It's Part C. In Indiana, we call it First Steps. So First Steps provides early intervention services for children birth to age 3 who have developmental delays or show signs of being at risk to have delays in the future. Down syndrome, again, is probably a qualifying condition. Services are coordinated to give qualifying children the widest possible array of early intervention resources. Families can self-refer to this program and don't need a doctor's referral to access it. So if you're interested in accessing First Steps therapies, OT, PT, service coordination, a variety of services, you can self-refer to First Steps. You don't have to wait for a doctor's order in order to do that. We know that one of the big goals we get when families move to Indiana is around childcare, because this again varies from state to state quite a bit. So we have vouchers in Indiana. They're available to families with an income up to 127% of federal poverty level and who meet other eligibility criteria. Vouchers provide childcare assistance for typically developing children up to age 12, no age limit for children with special health care needs, including Down syndrome. Funding for vouchers is county specific, so there are often waiting lists. A big part of your child's life and day is going to be spent at school. So federally, everybody has to follow IDEA, the Individuals with Disabilities Education Act, but it may look a little bit different in each state based on funding and some changes that they can make to the law, but they have to be a higher compliance, not a lesser compliance than the federal definition. So special education services begin at age 3 for children who qualify for an individual education plan or IEP, and supports and therapy services continue through age 22 in Indiana, which again can vary from state to state depending on the child's diagnosis and needs. We do start transition earlier in Indiana. Nationally, it starts at age 16, but in Indiana, we start transition planning for adulthood at age 14. And in Indiana, our special education laws are referred to as Article 7. So you'll hear agencies and families call it Article 7. It outlines our laws in Indiana and how they match the federal laws and or differ. There is a parent-friendly guide to Article 7 called Navigating the Course, Finding Your Way Through Indiana Special Education Law, and you can get that from InSource. They are our parent training and information center. Every state has one, just like every state has a family-to-family health information center. We focus on healthcare financing. The parent training and information center specializes more in special education law and advocacy. Most children with Down syndrome are probably going to be eligible for special education services and an individual education plan, but I want to make sure that other people who might be watching this know that Section 504 plans provide accommodations for children who are not eligible for special education and related services under IDEA, but whose illnesses, physical or mental disability substantially limits one or more life activities such as caring for oneself, seeing, breathing, learning, and walking. Students with asthma, diabetes, allergies, cerebral palsy, and other chronic health conditions may be eligible for a 504 plan. If you're covered by special education services through an IEP, you're automatically covered by 504. But this is for students and individuals who might not meet a level of need for special education services, but still need some accommodations. School choice vouchers are available upon request to Indiana families with students who meet both household income requirements and student eligibility. Students eligible to receive special education funds are eligible to use those funds for special education services at a voucher accepting school. In Indiana, homeschooling is considered a private school placement. This is another thing that sometimes varies from state to state, so you'll want to be familiar with our rules and regulations for homeschooling. The public school district of record is responsible for offering a service plan to eligible students. That won't be as comprehensive as an IEP, but it can still provide some services. Another thing that families frequently are asking about is for adult children, guardianship. So this is something you need to look at if you're going to be moving an individual for which you have guardianship to another state. If you look at guardianship laws, there's frequently a requirement that you seek permission before moving them to another state because there are some things that you need to do. So most states require a guardian to petition the court that granted the original guardianship, so wherever you live now, for permission to transfer the guardianship to a court in the new state of residence. The court in the new state of residence will want to be assured that the initial appointment was consistent with its own laws and to ensure certain safeguards for the ward are met. The court in the transferring state will want to make sure that adequate provisions for the ward's health and safety are being met in the new state of residence. So you will want to talk to an elder law attorney or someone to make sure that you consider these different rules across state lines if you're moving an adult for which you are the guardian to Indiana or any other state. I wanted to make sure that you know in Indiana, you can also call 211 to connect with food, shelter, housing assistance, employment services, counseling resources, and much more. So if you need help with things beyond necessarily disability-specific services, feel free to call them and they can help you connect with local equivalents in our state. So if you have questions about any of these programs, this is kind of an overview. We have fact sheets about a lot of these programs, or we can connect you with the agencies that you need to talk to get more information. You can feel free to contact Family Voices Indiana for additional questions or assistance. Our services are free to families. We serve children 0 to 21, but if you're a little over that, we can help connect you with the adult agency that you might need to talk to. Just call 844-F2F-INFO, or you can email us at info@fvindiana.org. Thanks for joining us.